afternoon, and thank you so much for joining us today for the NeedyMeds special topic webinar, EyeCare America, Protecting Your Sight and Empowering Your Life. My name is Carla, and I am the Education Coordinator here at NeedyMeds. And before we get started, I'm going to go over a few housekeeping tips. If you have questions, feel free to type them into the question section of your GoToWebinar control panel, which should remain on your desktop. We will do our best to answer all questions at the end of the webinar, but please note, if we don't get a chance to get to your question, we will certainly follow up with you personally via email at a later time. This webinar will be recorded. Once it has been turned into a video, it will be uploaded on the NeedyMeds YouTube page. We will follow up with you via email to let you know when that video has been posted, and also to provide you with the PowerPoint presentations that are accompanying this webinar if you're interested. If you do have technical difficulties throughout the webinar, such as the audio or visual not working properly, please send me a message also in the question section of the GoToWebinar panel. And with that, we're ready to begin. We are thrilled to have with us today Betty Lucas, who has been the director of the American Academy of Ophthalmology EyeCare America program for the last 16 years. Prior to joining the Academy, Betty spent 20 years helping the underserved by running and designing volunteer programs for nonprofit organizations, specifically in the Bay Area, and designing pro bono law clinics in Alameda County. We literally cannot think of anyone more qualified than Betty to walk us through what EyeCare America is and how it can help you, your loved ones, and your patients. Before I turn the mic over to Betty, I'll just take a moment to introduce you also to NeedyMeds. In case you haven't heard of us before, we are a national nonprofit dedicated to educating and empowering people seeking affordable health care. And one of the ways that we take care of the education piece is by partnering with nonprofit organizations such as EyeCare America that do great work. And excuse the error on that PowerPoint presentation, which will be updated before I send it out to everybody. And with that, I'm going to go ahead and pass the mic and the visual over to you, Betty. So bear with us a moment.
Thank you so much, Carla, and NeedyMeds. I really appreciate being here. As you can see, that we're a national public service program that provides eye care through volunteer ophthalmologists. And EyeCare America has two national public service programs. We started out with one. Our flagship program is the seniors program, and that's designed for medically underserved seniors and those who are at 65 and older. Hold on, getting used to this little clicking thing. Here we go. And then we also have another program that was launched many years later called the Glaucoma program. And this is designed for those who are at increased risk for glaucoma. And that is determined by their age, race, and family history. We're one of the largest public service programs in American medicine. This is one of the largest of its kind in American medicine. And we've helped more than 1.8 million people since our inception in 1985. We are just getting ready to update that number because it's at 1.9 million now. And more than 90% of the care is provided at no out-of-pocket cost to the patients. In the beginning, we actually launched in 1985, but Dr. Hutchinson, you can see in the picture to the left is Dr. Hutchinson shaking hands with Reagan, who President Reagan at the time helped us launch the program in 1983. We piloted in 3 different states. And the reason we exist is because Dr. Hutchinson got tired of seeing so many older people too late to stop the progression of eye diseases. Many eye diseases have no early warning signs. So his dream was to have a program like this, and the American Academy and all of its members helped this begin in 1985. They recruited a pool of ophthalmologists, one champion in every state. And in the very beginning, they started out with more than 6,000, and we are still close to that number today. We introduced this to Congress. We publicized this all over in all different ways, and many of our partners and people that we publicize, or organizations that we publicize to, are naturally the AARP, the National Council on Aging, the National Eye Institute, Council on Aging, every senior center, nurses, social workers. We work with partners like NeedyMeds to help get the word out. In our 25th year of service, we were recognized by the Senate and House resolutions, and by every president since Ronald Reagan, we've been recognized. Ronald Reagan's quote was, "Volunteering at its finest." Our senior program, the criteria was set by the federal government, and I'll talk a little bit more about that later, but in order to be eligible, a senior must be 65 or older, a U.S. citizen or legal resident, not have had a medical eye exam by an ophthalmologist in 3 or more years, and must not belong to an HMO or have EyeCare through the Veterans Administration. Eligible seniors receive an eye exam and up to 1 year of care at no out-of-pocket cost for any condition diagnosed during the initial exam. Volunteer ophthalmologists are able to bill Medicare and waive co-payments, accepting Medicare or other insurance reimbursement as payment in full. And this is one of the things that is unique about EyeCare America. Close to the very beginning, when we set out our program, the federal government provided an Office of the Inspector General Advisory Opinion, number 99-7, which permits only EyeCare America volunteers to legally waive Medicare copayments and unmet deductibles for EyeCare America patients. And this is a program that sets us out from all. This is why we're one of the largest public service programs of its kind in medicine, because there are very few waivers from the federal government, allowing ophthalmologists only who are volunteers to be able to legally waive these copayments and unmet deductibles. It is not legal for a doctor to do that without this waiver. And that's why we're able to have a program lasting for more than 30 years and having more than 6,000 or nearly 6,000 volunteers participating, because it's not going to break the bank for them. They can help somebody who is medically underserved, might be able to afford other things, but that out-of-pocket cost can be what keeps them from being seen. We wanted also to be able to expand the program because we were missing a lot of people who were just under 65, but they might be at increased risk for glaucoma. And so we created the glaucoma program. And those not eligible for the EyeCare America Seniors program may be eligible for a glaucoma eye examination if they're, again, U.S. citizens or legal residents, not have had an eye exam in 12 months or more. So that's very different than the 3 years, but this provides something very different. They have to be determined to be at increased risk for glaucoma by a weighted measurement of their age, race, and family history. Once they answer those questions, the computer will calculate their eligibility for this program. At the same time, it's calculating their eligibility for the seniors program. So if they're 65 and older and they haven't had seen an ophthalmologist in 3 or more years, the computer will already see that they're going to be eligible for the seniors program. But let's say it's been 2 years, they might be eligible for, or they're under 65, they might be determined to be at increased risk for glaucoma and be eligible for the glaucoma program. And through all of our programs, they can't belong to an HMO or have EyeCare through the Veterans Administration, and this is due to our waiver. Part of the agreement with the federal government is that we would have all of these criteria, the U.S. citizens, not have seen an eye exam, an ophthalmologist in 3 or more years, because the federal government considers 3 years you are not in the system. We don't want to refer a patient who already has an ophthalmologist. And not belong to an HMO or the VA is because our rotation for the match of a doctor to a patient must consider a number of different things, whether or not they are insured or uninsured, whether they've been sent to one doctor. We don't want to keep sending to the same doctor. It has to rotate. So there's a lot of criteria that goes into the random rotation. And if they belong to an HMO and that doctor doesn't accept that HMO, that would be problematic for the patient. So that is why we have that criteria. In the glaucoma program, those patients who are eligible and uninsured receive the glaucoma exam for no charge. If they are insured, the patients receive the exam and are billed normal office procedure. This is an awareness program for people who may not know they're at increased risk for glaucoma. The initiation may be provided if it's deemed necessary by the ophthalmologist, but it is, again, it is a program that allows somebody to have a baseline eye exam, and that is very important for anyone with glaucoma. This is a lifelong disease or condition, and we can't see them for the rest of their life, but we can at least get them set up and refer them to perhaps another program, or this is where NeedyMeds comes in. We offer online pharmaceutical assistance programs listed through the NeedyMeds website, and our doctors can see if they might be eligible for pharmaceutical assistance, which is often one of the major treatments of glaucoma. You might wonder, we've got an online referral system. We are how patients find us. They find us online and through a number of different ways in which we promote the program. And visitors will complete an online questionnaire, which is basically going to collect all the criteria we'll need to see whether they're eligible or not. As you can see, of course, their name and address we'll need to collect just to be able to match them by zip code with a nearest doctor who's a volunteer, but also citizenship. They have to be a U.S. citizen or legal resident, their age, race, and glaucoma family history for their glaucoma risk, and then whether or not they have insurance will indicate if we refer an uninsured patient to one doctor, the next one hopefully will be insured so that it can be a balance. And then eligible patients receive a letter with the name of the volunteer to call for an appointment, and the volunteer receives a letter with the patient's name to expect that call, and then they also send back an outcome form to return to EyeCare America just to tell us what they diagnosed and estimating how much care that patient needed, because it's not just the one visit, it's up to 1 year of care for our seniors program. So you might wonder, okay, well, how can you help people without computers? A lot of people in need, we know, especially our audience, seniors, may not have a computer right at their home or accessible, but social workers and health professionals and individuals throughout the U.S. It could be their family member, friends who have a computer. They can even do it on their iPhone. These are ways they can help their clients or friends and family see if they qualify. And you can do it by answering just those few questions, and the computer will automatically calculate whether you're eligible or not. And I can tell you that 28% of our referrals are through these people, social workers, health professionals, and individuals. We partner. One of the greatest things we do is our grassroots with getting the word out through our partners. These are groups and individuals, national organizations that serve older Americans. We offer free brochures, risk factor cards for AMD, age-related macular degeneration, and for glaucoma risk. We offer flyers and discount drug cards. Now this is something that we're doing. Every single person that receives a referral also receives a discount drug card. This NeedyMeds campaign that we're partnering with NeedyMeds on, it's been really phenomenal. We've actually, since we started, which was in February, a very light launch. It wasn't until April that we really fully launched. So I pretty much only count since April. We've saved $15,000 for people in addition to whatever other care we provide. That's for drug-related medications. So in addition to serving eligible patients, we on our website, we offer an online list of other medical services and a list of discount eyeglass resources. That's a big black hole in the U.S., and so we also partner with other organizations. When people call us, we might not be able to help some of the people that end up contacting us because they may not be eligible for our services, but all they want are eyeglasses. So we send them a list of discount eyeglass resources, but you need to have that refraction exam. And so we work with other organizations, the Lions and Prevent Blindness, and we send out information for them about these programs that they might be eligible for. Most of the programs that are out there are for people who are under the poverty level, and they have to provide a lot of information to be able to be eligible, but at least it's something. And then, of course, we have our Assistance with Medication webpage linked to the NeedyMeds site and our discount drug card that I've already mentioned. We receive cards and letters from grateful patients every day, and even from our doctors, and this is just one wonderful quote from a patient. Many people are just caught with not having the access, having to decide whether or not they're going to spend their money on food or on medications, and to pay that out-of-pocket cost is just one more thing that they cannot do. And so EyeCare America is not saving the world, but we are helping a small sector of society. We refer about 10 to 15,000 people per year. So I would like to open this up to any questions, and I hope I have answers. Thank you for your time.
Fantastic. Thank you so much, Betty, for that very exhaustive and extremely informative presentation. I personally, although I'm quite familiar with EyeCare America because we have the privilege of partnering with you with NeedyMeds, I didn't realize the extent and the scope of the populations you reached. Some of the stats you put out there, not only in addition to the long and proud history you have, but the fact that you've helped just under 2 million people, 1.9 million people, and 90% of the help is at no out-of-pocket cost. That's really quite something to be proud of, and we at NeedyMeds are so happy and honored to be partnering with you guys and helping with this webinar, certainly to spread the word. As Betty said, we can go ahead and open up the floor for questions, and if we don't get a chance to answer your question this afternoon, we of course will follow up with you via email. So let's take a look and see what's coming in. So this maybe, Betty, I think a couple of questions came in that were already clarified later in the presentation, but maybe if you can talk a little bit more just to clarify that, let's say a person is treated and needs glasses, what is the process for them to go ahead and get those glasses again, if you could just reiterate that.
Oh, absolutely. One thing I should have said is eyeglasses is not a part of a comprehensive eye exam, medical eye exam. Refraction is a totally separate part of it. And so the eyeglasses are provided when it is covered under, let's say somebody has cataract surgery and needs eyeglasses. That is the way that it is provided. Otherwise, refraction is not a part of a comprehensive medical eye exam, believe it or not. And that's why I said there's this black hole about eyeglasses. It's one of the calls that we get most often from people who are not eligible, or even people who are eligible. They're happy to have had their eye exam, but they also need glasses. Some people think they need glasses when in fact there's a condition that is either presenting like as if they think they need glasses and they actually have cataract or glaucoma or AMD. And so I'm sorry I didn't mention that EyeCare America does not provide eyeglasses. It's just not a part of the comprehensive medical exam, which I think is problematic, but I didn't make the rules. Medicare and these are insurance rules. So a refraction exam done typically by an optometrist is not something that is a part of EyeCare America. Therefore, we provide lists of discount eyeglasses and different services that might have some, such as Prevent Blindness, might have some services that you may be eligible for. The Lions, United Way, Salvation Army, sometimes clinics. We tell people to call their local public health department. Some areas will have clinics that we don't even know about, but we try to partner with all sorts of different organizations because we know that eyeglasses is a big black hole, and not just in the U.S., it's in the world.
Thank you so much. That certainly and thoroughly answers that question. And I'd like to piggyback on something that you mentioned. It's wonderful that EyeCare America recognized that that's also a big need, and so because of that, they try and fill it and point people in the right direction, providing lists and possible discounts. You can always also, in addition to that, check out the NeedyMeds website or call our 800 number, and there's a few places that we can help you with. We might be able to point you in the direction of a free, low-cost or sliding scale clinic. We might actually have a coupon or a rebate. And we also have an entire database dedicated to diagnosis-based assistance programs. And what those mean are those are programs for costs for healthcare expenses that fall outside of medication. And we all know that medication, as we've just talked about, isn't the only thing sometimes that we pay a lot of money for. Sometimes we need testing strips, let's say if we're diabetic, or assistive technology, or other healthcare related things that don't fall under that neat umbrella of medication. So you can feel free to check out our website and check out in particular our diagnosis-based assistance programs to see if there are any glasses or eye care coupons, rebates, or programs available.
Wow. This is really new information to me. I apologize for not knowing this, but we are going to put you on our eyeglasses list as well. So they find it under the diagnosis.
Right. So on the NeedyMeds website, you can check under the diagnosis-based assistance programs. And I will say you're going to want to check our website regularly. Our programs are updated all the time. Sometimes there might be programs listed and sometimes not, but it's certainly worth checking out the website or giving our 800 number a call.
Oh, that's wonderful. Particularly the coupon, the rebate, the clinics, the costs, all of that. It's just another service. This is wonderful.
It really is. It really is. Thank you. And I don't see any more questions coming in, but rest assured that if you think of anything after this, please feel free to send an email to EyeCare America right there on your screen, or you can hit me up at carla@needymeds.org. Again, my name is Carla Della Porta, and this has been Betty Lucas from EyeCare America this afternoon. As I said, we'll follow up with you by sending you, letting you know where you can find a video of this PowerPoint presentation and webinar, and we'll go ahead and send you PDF versions of the PowerPoint presentation so you can share with your friends, family, and colleagues. For now, thank you so much for taking time out of what is no doubt a busy day during a busy season to learn a little bit more about EyeCare America, this really invaluable resource. And happy holidays. And thank you, Betty.
Oh, thank you, Carla. Thank you, everybody. Bye.
Good afternoon. Bye-bye.